Canadians that say that they did not access services but had a need that was unmet, they were not able to get that care because in part there was an internalized stigma that they preferred to manage their symptoms on their own.
How can a set of skills lead you down the path to success? That's what we're setting out to answer on the Educ Canada podcast. I'm your host, Michael Sangster. Join me as we unpack how leaders around the world have taken training and skills and turned that into a lasting career. Now let's learn together. Welcome back to the Educ Canada podcast. I'm Michael Sangster, your host, and we're at episode 56 here. No, we said we'd get past 5, but we're having fun. And we are joined today by Dr. Leyna Lowe, who's here to talk to us about a bunch of interesting topics around mental health, substance abuse, the classroom. It's Mental Health Awareness Month here in Canada, right, Doctor?
Yeah, and we're actually kickstarting Mental Health Week this week, which we're really excited about.
That's right. So why don't you take a moment, introduce yourself, the organization you work with, and why you're going to be speaking to our members on Thursday on one of our member meetings.
Great. It's such a pleasure to be here. I'm the National Senior Research and Policy Analyst with the Canadian Mental Health Association's National Office. And for those of you that might not know what CMHA is and what we do, we're a national organization made up of branches and divisions all across Canada, and we're in 330 communities all across Canada. And we're really a community mental health organization that does frontline service provision, mental health promotion and awareness, advocacy, education around mental health, substance use disorders, mental illness across Canada.
That's a mouthful of the work, the important work that your organization is doing. How about your own self? Maybe a little bit more about your own role in the organization and the things that you're focused on.
So in my role, I work in research and policy, and in the national office, we do quite a bit of federal advocacy. So what we do is we look at some of the evidence base when it comes to mental health and substance use disorders and mental illnesses. You know, we do all sorts of things. We publish knowledge and information into our website. We develop policy positions. We lead original research projects and work in partnership with other stakeholders on research projects. And really importantly, we take the core issues that are important to our federation that pertain to mental illness, substance use disorders, and we bring it to the federal government because there are certain things that we need to see policy change around mental health. And so we bring that in front of federal decision makers in the hopes that we can see change in making things like mental health services much more accessible than they currently are.
And you're doing a lot of work around classroom tools as well that we're going to talk about a little bit today. I want to touch off this Mental Health Awareness Week because there's been a change, and I want to get your own personal opinion, not work, but I could be sitting around with 7 or 8 of my guy friends at the golf course now, and people will openly talk about mental health issues now. A bunch of men who've just played golf, and we got a couple of beers in front of us, and there's less of a stigma of actually having a conversation about those kind of issues, and it's because of organizations like yours. But there's a sea change happening, isn't there?
I'm glad you bring that up, Michael. The theme for mental health this year is actually about masking and unmasking. And part of the reason why this was identified as a theme is that even though mental health is something that people are more willing and able to talk about nowadays, masking and the idea of suppressing or hiding your emotions, thoughts, behaviors, any mental health distress is still a really big problem. So often masking, and let's break it down for a minute. So what masking is it's really a coping mechanism that people might do consciously or unconsciously. And it's this idea of hiding or suppressing their thoughts, their feelings. And one of the reasons why people mask is related to stigma. So we know that mental illness, and especially addictions or substance use disorders, and even struggles with poor mental health, it's really stigmatized to be able to talk about those things. And what we saw, like when we looked into some of the research, what we found is that people who say that their mental health is poorer are more likely to experience discrimination. We found that people who are struggling with an addictions, about half of them are afraid to disclose that they have an addiction because they feel stigmatized. And we also found that in some of the older research, Canadians that say that they did not access services but had a need. And so we know that talking about mental illness and when you have struggles with mental health is still a huge barrier.
I am optimistic. I do see a bit of a change amongst, and it's just my own little peer group, but a bunch of idiotic men sitting around being open about talking about stuff that would never have done that 10 years ago. So if it makes you and your coworkers feel good, I think there is something changing. There is an openness to the conversation. And there's not a college that I deal with in our group of members that isn't thinking about this in some way, finding programs, looking at bringing it into the systems of how they teach and how they interact with their students. And most importantly, in that conversation is what happened during COVID, where they went from having a direct contact and having a really good feel for the students in the classroom to then teaching online, which has continued. And the instructors that have been around are struggling with that connection, that ability to see if a student's struggling, mental health issues, financial issues, which is always another trigger for people with their mental health, as you probably know better than I do from your work. So I'm intrigued to see where more of this stuff goes in the future. Talk to me about your classroom tools, because I know our members are going to be quite interested in hearing more about that.
Yeah, so as part of Mental Health Week, we designed a teacher's toolkit. And it's meant to be a resource that teachers can use in the classroom. And this is something you might be familiar with as well. Teachers really are frontline providers when it comes to mental health in the classroom. They, in the classroom, have students showing up every day or every week. And so they, build relationships with their students. They get to know them in the classroom setting. And so they are often one of the first people to notice when something's amiss, right? If a student's not showing up, if they're not themselves, if they've become withdrawn or disconnected when they were previously a really engaged student. And so teachers are at the front lines of being able to see that there's a problem and hopefully help students identify what they need or find the appropriate resources to help them. And so the toolkit really is a way to think about the role of teachers and also to center and address mental health concerns as they come up. So one of the caveats, though, that we do discuss in the toolkit is that there needs to be a certain amount of awareness about safety. Just because disclosing mental health concerns, especially in a public setting like a classroom, really can expose students to a lot of vulnerability. And so we couch the toolkit in kind of a framework of what it means to think about the student's safety. So under no circumstances do we ever want to encourage teachers to encourage students to disclose a mental health concern in the classroom. The idea of the toolkit is to get teachers to think about how we can start normalizing conversations about mental health and addictions or substance use problems in that setting. But under no circumstances will it ever be like a compulsion to disclose if somebody is struggling. But teachers here are able to, especially if a student does volunteer information that they are struggling, that teacher could really be a critical asset for that student's wellness. So what we did find, or what we did suggest, is that there are a few things that teachers can do if a student does disclose. So part of it would be, again, normalizing conversations about mental health in the classroom. And it doesn't need to even be a topic that's separate unto itself. teachers can also find ways to integrate mental health, like conversations about mental health into the curriculum. So it doesn't need to be, its own subject. Teachers, when they do encounter a student who discloses very personal or vulnerable information, listening, affirming, hearing a student is just so critical, because one of the most damaging things that someone can do, when somebody is vulnerable and discloses, is to deny or to minimize what they're going through. And sometimes, it's a very serious concern that they're experiencing. And so to have that affirmation, to be heard, is just so important. The other role that teachers can take on if a student does disclose, and especially if it's in a more public forum, is they can respond to the student by saying, hey, let's talk about this after class. Because the reality is that when a student discloses in a public setting, it can expose them to bullying. It can expose them to violence, right? Because you never know how peers are going to respond. And sometimes that can really reinforce the trauma that a student is already experiencing. So a teacher can say, let's chat about this after class. And if the teacher feels like maybe they're not the right person to talk to, they can direct students to mental health supports that are built into the school, a guidance counselor. Many campuses do have mental health supports built in. And so directing students to those supports, or if they're in crisis, calling 988, getting supports if they're having any, thoughts of suicide, going to the emergency room. Like those are some strategies that teachers can, or resources that they can direct them to. And the last thing also is just, after a teacher has received a disclosure from a student, checking in and following up just to make sure that they're okay and that they're getting the supports that they need is really important. Because again, for students, especially if they've gone on to higher education, if they're out of their usual support network, that in itself is such a struggle, right? And so to know that there are people around them that love and that care about them and that are worried about their well-being could really make a huge difference in students' lives.
Talk to me a little bit. I don't think we talk about 988 enough and what it is. It's a resource available to people that I don't think there's a great awareness to.
Yeah, 988 was recently introduced, and it's a national distress line that people can call. So if they're experiencing thoughts of suicide, if they're experiencing, thoughts of harming themselves, if they're just under extreme distress, or they don't know who to turn to, they don't know who to speak with, they can call that line and get immediate talk or text support. And it's interesting, part of our advocacy at CMHA is that this line is amazing, but it's not the only thing that we need, because when it comes to mental health distress, we also want to prevent people from getting to that place in the first place. And so that means making sure that people have adequate supports in preventing and promoting mental health, right? In ensuring that when people are feeling unease and distress earlier on, they're able to get connected with those necessary services, with addiction services, with counseling, so that they don't get to a point where they feel like their life is at risk, right? Or that they're going to harm themselves. And also when people call 988, one thing that we're really advocating for is supports after people call. And so just making sure that people have any of the necessary follow-up, the counseling supports. Maybe people need help accessing things like housing. Those are really important things to build into our response when someone's in distress.
I can't agree more. It's interesting. One of the things that I gravitated when I took on this role with the career colleges was to a group called Enriched Academy. And it's not the same topic, but they focus on financial literacy. And one of the things that we see with our students is the stress levels around finances. And that can also affect, obviously, your mental health and your relationships with people and housing. It's funny you mentioned housing. That has become a major concern of people now.
Yes, and we are very much in a housing crisis. That we're in an affordability crisis where people are just having a hard time making ends meet. They're having trouble with food security and accessing food. And, these realities are especially pertinent for students, right? Because students are often, they're going through difficult transitions. They may have left home for the first time and have their first place by themselves or with roommates. It's a time of transition and of rapid change for them. And, students are managing classes. Sometimes they're having to work and juggle, priorities to be able to make ends meet. And developmentally, it's also a more vulnerable time for mental illness and substance use disorders. Students are often in new social situations and exposed to potentially new substances, right? They're navigating new peer relationships. Yeah, there's just a lot of pressure. And then to succeed academically and be able to pay their rent.
I was talking to one of our college presidents, and they were talking about a younger student. Our students are usually in their 30s, more predominantly female than male. People taking a second career, a second chance, a restart. But this was a younger student, and they were really struggling with their mental health. But one of the things they discovered was teamwork. They were younger. They hadn't done that in COVID in their formative last, grade 10, 11, 12, because they weren't in a classroom with other people where they worked together in the same way. And they were struggling with the interaction. So we never know what someone's going through. And that to me is the biggest point of a week like this, is stopping and realizing that we can all have an impact on somebody else's life. Like just keeping your head up and being aware of what's going on around you, whether you're an instructor, a colleague, or a friend, that there's something going on in someone's life that you have no idea.
Yeah. And I'm glad you bring that up, actually. In thinking about masking, one thing that we kept coming back to when thinking about this theme is also the reality that with social media, we're dealing with a different type of animal. Masking is very much a reality as people have developed more of an online presence. In a lot of ways, we have kind of these curated identities, right? That the image that we're presenting of ourselves on social media are often the happy version, the successful version, people that are happy in their careers. You don't see the underlying struggle, the underlying humanity. And that in itself is, it can be damaging to self, of course. It can create underlying feelings of shame or fear about being able to reveal the more authentic parts of oneself. But also for other people, they see these images, these idealized images of other people on social media, and then think, what's wrong with me? Then they think of themselves as having a deficit. Why am I not so happy? Why am I not so successful as these other people on social media? And so in a lot of ways, it's damaging.
Well, then back to my full circle, and I'll ask you one of our regular questions, but to go full circle back to that group of idiots that I golf with, for one of them to mention last summer an issue they were dealing with, and everybody leaned in. Nobody leaned back. Everybody leaned in and kept an eye on them. And it was a small little thing, but it was just having a bit of a struggle. And it's interesting to see the way, to me, that as a guy in his 50s now, it's changed.
Yeah.
That might have been somebody who got picked on 20 years ago where jokes were told, so no one would have even felt good about saying anything, right? So we've got to keep playing. These weeks are important.
Yes.
As Mental Health Awareness Week, it's important to stop and have a week where people go, what is this? Because it is going all year. I found it interesting. I serve on the board of Health Partners, which is a group of national health charities as their vice chair for fundraising. And we let in a mental health organization, the Mental Health Commission this year came in to help us raise money for them for the work they do. And that's the first time a group like that's been included too. So I thought that was also a good sign of where things are going with the way people think about the world. So we'll get a little personal now. We always ask people a couple of questions and this is probably the most appropriate one when I've asked this question, is asking you now about this, because we ask every one of our guests about a mentor they've had, because part of our goal, and we do on Mondays, we do Mentor Mondays where we slice out a little bit of the interview and we repeat. But mentoring is another way of someone's helped you with your mental health or your career or your own path. So tell me a little bit about a mentor in your life that's changed your path.
That's an interesting question. I'm very much, I'm a researcher and I live in the world of ideas. And so for me, when I think of some of the people that have left their mark on me, it's a lot of them are theorists or practitioners. So one of the ones that really sticks out is Dr. Gabor Mate. he was a family physician on the downtown east side of Vancouver for most of his career. I think he's retired now. And it really speaks to this theme of masking, but he wrote about the health impacts of mental health distress, especially when it's suppressed in the body. And what he's found throughout his medical practice is that when people suppress or deny their mental health struggles, their concerns, it finds a way of coming out. And one of those ways is through physical health conditions. And his work is just amazing. He's very much focused on trauma and about our humanity and how healing really is a journey of working through one's trauma, through pain. And this is he's such a humanizing practitioner that it's just really left a mark on my own perspective on life and my work.
I always ask, do you think he knows that he was a mentor to you?
That's a good question. I honestly, I don't know. I mean,
we'll share the episode.
Yeah.
It's interesting how many do know and don't, and how many you don't know, that whether the individual knows that, what an important role they played in their lives. So the last question I'll ask you before we'll circle back quickly, but talk to me about a skill, because our colleges, our members that you're going to speak to on Thursday are all about training skills for jobs, directly to go to a career, directly to go to a job. But I think there's a bunch of intangible stuff that gets taught in groups or individuals that makes people successful, and students don't necessarily have a chance to stop and think about something. You're a researcher. It could be about your focus on data or ideas. I'm not sure. But tell me about a skill that you think has made you successful.
One of the skills that makes me successful is problem solving. And I'm going to speak to it specifically to my own research, but I think this really applies to any or many types of disciplines. Part of my work as a researcher is I'm presented with a research question or a problem, and it's about sussing out like what are the core issues of that problem. So it's like, doing a survey of all of, whatever data is accessible to me, and then getting under it and finding out like what are some of the core problems. But part of that problem solving also means being able to communicate the findings in a way that people will be interested in and will read it. And so I don't like to produce research that's just going to like get read by other academics or, get a little bit dusty on the shelf. I think it's really impactful to be able to take complex ideas and then to communicate in a way that makes sense to the general population, to teachers, to educators, to politicians. And so it means taking these ideas and speaking other people's language, right? To be able to break down a concept so that it's relatable, understandable, and something that's usable.
That's a real skill. Mm-hmm. We all look at data and we look at information, but turning it into something real and tangible that can make sense for someone is an incredible skill. So I want to thank you. We try and keep these episodes below 30 minutes, but I do want to thank you for joining us today. I'm really excited about the session. I believe it's on Thursday this week you're doing with our members across Canada. We've actually got one of our largest confirmations of attendance we've ever had for one of our events. So it should be a good turnout. Many of these members are busy teaching and busy running their colleges. And they've all stopped, or a bunch of them stopped to take a look at what you're doing to see how does it help them better affect their students' lives. So I'm really looking forward to it. So is there anything else that you'd like to get across while we're in Mental Health Awareness Week, or just in general about the work your organization's doing?
Did you want to know a little bit of information specifically about the toolkit? Because I know I spoke to like the teacher element and the disclosure, but there's also the activity side that I didn't delve into.
I think that'd be great. We've got time. That'd be wonderful.
So some of the activities in the toolkit are meant to normalize and center conversations around mental health. Interestingly, some mental health practitioners who do counseling and therapy and trauma work actually find that masking and the concept of exploring masking can be a practice itself to be able to promote healing. So in the toolkit, and this is kind of a fun activity for, younger students, but we have masks that you can print out and, decorate and work on. And it's such a meaningful practice that some art therapists use because, the concept of masking is just so important to working through one's trauma. And, doing art therapy in practice can help explore those unconscious or repressed emotions, right, that people are experiencing. And so it's used as a therapeutic practice to be able to work through the pain and work through the trauma to promote healing. And there are other activities in the toolkit that explore stigma, that explore, reasons why people would be masking. Some important ones that I didn't touch on are related to violence. So commonly, a reason why people mask is because it's a survival strategy. They're confronting homophobic hate, anti-trans hate. They're experiencing gender-based violence or racism. And we know that masking can often be a response to internalized racism, right? Or a way to cope with those oppressions or those violences that people are experiencing. So it's part of it is to also take the shame away from the idea that some people do mask as a survival strategy and as a way to try and survive and be well. But of course, unmasking is such an important theme for us this week because it really points to the fact that if someone is masking for a sustained period of time, it's not only exhausting, but it leads to isolation, it leads to disconnection, withdrawal, the accumulated stresses that a person experiences if they have trauma and are masking. It could really lead to health conditions, right, that manifest through your body and not only psychological distress. And so the idea of being able to have safe people to talk to, of finding those necessary supports so that you can unpack that trauma and do the hard work, right? To be able to work through your pain is just so important. And the toolkit at least provides some strategies for students to do that work on their own, to journal and to think about some of the underlying reasons that they might be masking and who they might be able to speak with or what resources they can access to be able to get the supports that they need.
Now, it's a student toolkit and a teacher toolkit, but it's available online now to others as well, I assume?
It is, yeah. We have that resource and some others on our website. So that's mentalhealthweek.ca that you can go to and check out. We have got some fun resources on there.
Okay. I think that we're going to make sure we direct our members to that as well, but also people who listen to this podcast will attach that to the bottom of the podcast to make sure people can find those tools. I'm looking forward to Thursday, and I want to just take a moment. Thank you for giving us the time today. These are important conversations, and I think we walked around it in a kind of a nice way of just letting people be aware of some things that are available and that it's important to put your hand up and have a conversation. And if someone does that, it's important to make sure you deal with them in the right way. To make sure they feel heard and supported. If I got your message perfectly.
Yes.
So I saw you smiling, so I added the word perfectly. So with that, I think we'll leave it for today. As I said, I'm looking forward to Thursday. I appreciate you making the time today. And we will wrap up this week's edition of the Educ Canada podcast. Thanks for listening. Thanks for listening to another episode of the Educ Canada podcast. We release new episodes regularly, so make sure you hit that subscribe button so you know when they are officially out. If you love this episode, please leave a 4- or 5-star review wherever you listen to your podcasts so that others can also discover how a set of skills can lead to success. Thanks for learning with us.